Hi, everybody. This is Kiki Powell, and I just wanted to provide an introduction to Morgan Galloway, who is our research manager at Benefits Data Trust. Morgan is going to be talking to us today about user research was the topic that was voted on as the one that people wanted to learn. It's been really interesting in conversations that I've had with Morgan in learning more about user research, because that is not my area of expertise. And her vantage point on the language of community and user research. So we're going to learn a little bit more about that language today, but also the how. You can, Morgan, you can go for it. It's
It's
totally
me.
fine. Yeah, you're
Sure.
fine.
That was an accident
Yeah.
for sure.
Yeah, but also the how of community and user research. So looking forward to hearing from Morgan today. Morgan, if you want to introduce yourself, and then I can, along the way, I'll be offering or asking some questions of you, because I think that will just help facilitate
Totally.
some framing and understanding. But also, Morgan, we would welcome questions from people in the virtual room with us today. So please, if you have any questions, feel free to put those in chat, and we're happy to have dialogue along the way. So Morgan, please kick it off with introductions of yourself and a little bit of framing of this approach that I think we're going to take a little bit today, which is maybe more of, we're not saying we're the experts, but we have expertise in some things. I would actually say Morgan has expertise. But that BDT as an organization is still learning how to be good at user research. And so we're kind of on a learning journey ourselves. And I think that that's actually an interesting way to frame this conversation today.
Agreed. I cannot monitor the chat super well, so I'm just going to ask if you can keep your awesome. Thank you so much. So, hey everyone, I'm Morgan Galloway. Like Kiki said, I'm the community research manager slash more traditional evaluation type research manager at Benefits Data Trust. As she mentioned, this is a new role and sort of a new approach to us at Benefits Data Trust. So I joined this new role in October 2023. So it is a learning journey. Prior to BDT, I worked as a research and writing consultant for organizations like Libraries Without Borders, a couple of academic centers, some solo scholars. So yeah, this being a brand new position to me and to our organization, it's very much a learning journey. So I'm excited to talk to you guys about some of the challenges you face, because I'm sure that there are some of the challenges that you might be expecting, because I'm sure there's some that I'm facing also, and we can kind of work and talk about those things together. So my background is I'm trained as a political scientist. I received my PhD at Yale University around this time last year. Methodologically, I'm an ethnographer, which means I'm interested in deeply understanding people where they are and from their point of view. This has culminated. What this means in this particular role is that I have a goal to build a research agenda that centers the people we serve. This can be from a recently employed single parent to an unhoused young person who may struggle with drug addiction, to the staff who deliver these services, to the administrators, to the agencies, these sorts of things. Again, like he said, though I do have research expertise, that doesn't necessarily apply to every context. So a lot of it doesn't travel. I am learning a lot. A big part of what I'm learning is sort of the proportions, the alchemy of rigorous research from an academic lens with capacity, which we can talk about, with like what are actual practical solutions. And it's, we're figuring it out. And I think we're doing some pretty good work and learning along the way. So let me switch over. Okay, so yeah, also as Kiki mentioned, I'm going to give you guys a brief overview of what I mean by community research and where user research fits into that, which is community research encompasses user research. In my view, this is not doctrine. This is just my perspective on things and what I bring into the research that I do. So after I do that, I'm going to give a couple of examples of how we are going about applying these findings to improve the benefits landscape for those affected by financial shocks and challenges, which is the subject of your group. Then I'm going to briefly discuss some of the challenges we might encounter and like broad buckets of solutions. but I want to conclude with a pretty open-ended conversation about the challenges we're all facing and, or all, like I said, expecting to face, and collaboratively discuss some of those solutions. So to have a little bit more of a thought partnership and informal conversation. So user research, community research, user feedback. So we talk a lot about quote unquote getting user feedback and quote user research. And I think distinguishing between these two is an important jumping off point. But first, I want to note that what we might call user research is part of what I call community research. The main difference, kind of like a Venn diagram. The main difference being that community research is working within and with the community over the long durée. So it takes a long time. Whereas user research may, but doesn't necessarily have to be, a more one-off transaction between user and researcher. It can be. It can be just kind of a simple data gathering endeavor. I'm happy to talk more about this offline or in the Q&A if that's of interest, but I also think it's important to note, and this is part of research, that like my background, my focus on communities and researching in the community comes from my background as an ethnographer. So as an ethnographer, we're meant to immerse ourselves in communities for a long time. And that's often in this context, in the context that a lot of us are in, it's just not feasible in many of these contexts, including my own. But the reason that I kind of couch everything in community research terms is because I think it's really important to think about what the ideal would look like as we're creating the practical. So like having what would ideally be the way we can do things in the forefront of our mind might help us make different decisions. So with user research, to look at with this diagram. So user research tends to be ideally incorporated from the beginning of a project and in an ongoing iterative way. It's not generally just a one-time process. The idea is that by better understanding our users or staff or administrators, like our community, who we're defining as our community, we can build out the services, products, processes that work for them on their own terms. On the other side of that, and still super important, is gaining user feedback. So this often comes in the form of something, at BDT at least, in the form of like a client satisfaction survey. It can come in like a brief structured UX interview, or like a really narrowly focused focus group, a narrowly defined focus group. I think of user feedback as being generated from real users after a real interaction or a real event. And it's great to get like a temperature check on how well an existing process is working and how to potentially improve it in the future. So in short, this is like a perfect summation. User research starts from the beginning and influences the build. User feedback happens after the fact and modifies the process, the already existing process. So because I don't know you guys, I want to hear a little bit about where you all are in the feedback / research process. If you can just pop sort of what you're trying to learn at your organization or agency in the chat, that would be awesome. It can be super broad. And then later we'll talk about the challenges, but just kind of the broad research questions you guys are having. I'll give you a couple of minutes to do that.
That sounds great. Yeah, so please in the chat, if you wouldn't mind, there are some prompts, but I think Morgan's prompt is a little more general, but like, where are you at in your journey in attempting to use either user research or user feedback? And let's just give that,
Awesome.
I have it as 10:18. Let's give it to 10:20. One thing while they're doing that though, Morgan, that you said to me, and it like really kind of smacked me in the face a little bit, I'm not gonna lie, is the idea of defining a user, and that part of what we should be doing in user research is finding people who are not users, but we might want them to be users. And that was a little bit like, I was like, oh yeah, like, because I think in some ways it makes finding users in that broad definition, frankly, a little harder. Like, so talk a little bit about that framework.
Yeah, so I mean, I think that, so the way that I think about it is we have people who are already using a particular service, a particular product at BDT, a particular way to apply for public benefits, right? We are reaching a certain subgroup. There are plenty of people out there who we don't know what their challenges are, and I'll get a little bit more into this later. or who we don't know that we're not servicing, right? We don't know what we don't know. So we have to go in and assume. I don't know if assume is the right word, but I want to go in with like an open-ended framework to be like, okay, all people who are eligible for benefits, regardless of where they're getting their information, whether they've applied, whether they've been denied, how long they've been on them, what sort of outreach they've received, all have a perspective to share with us that could increase our user base, we could then end up reaching another demographic. Does that answer your question?
Sorry, doing two things at once. Yes, it
You're
does.
good.
I was also just putting the prompt in the chat, just making sure that everyone has the opportunity. I haven't seen any respondents. So I'm going to have Morgan go on to the next
Yeah,
slide,
sure.
but I'm hoping that this question is actually important because it's supposed to inform our dialogue later. So again, if you are here and you could put in the chat where you are at in using user research or user feedback, that would be great. Go ahead, Morgan.
Awesome. Cool. So, so as mentioned, like this is a new structure to our research agenda, and we are trying to think about it in this very intersectional approach. So the way that I'm situated in the organization is we have a research and insights team that is not just traditional researchers, right? We have human-centered design experts, community research, who's me, and then policy and practice research, and we all talk to each other at the same time, or all talk to each other at all times, excuse me, about where we're at and how we can sort of work together. For this purpose, however, I'm mostly going to just talk about the relationship between community research and service design, because I think that's most pertinent to the user research we're talking about here. So brief overview of community research, and then I'm going to give you an overview of service design. So community research typically occurs, again, this is sort of a stand-in for user research, in the discovery phase, and often takes a lot of time. It may be carried out over months or years, because as opposed to just traditional user research, it's really important to build trust in the community, especially when we're working with vulnerable or marginalized populations, or populations who just have needs that like general consumers may not have. We use research methods that center the human, right? We do open-ended interviews that let a client tell their story on their own terms. We might design our focus groups to take seriously a participant's comfort level. Participant observation is part of it, and like advisory groups. I'm not going to get too much into the weeds with this. We can talk about that offline also. But the crux is like the human is the most important part of the whole research puzzle. So by developing research relationships in the community and focusing on these human lived experiences, we're able to uncover nuances that we wouldn't necessarily be able to do by dropping in, gathering data really quickly, and then leaving, or just administering a survey cold, right? We might want to do a community research, discovery community research first to decide what we want to survey. But then we have service design, which steps in and applies those nuanced findings that I talked about here, these nuances between communities and groups, to along with participant observation, maybe with UX research. They also bring in interviews with other people, so staff, administrators. They'll do landscape analyses. They'll get a very broad picture of things. In order, this is all to build a service or a product from end to end. So it involves the people we're designing the product for from the very beginning. And that's not necessarily the beginning of when you and I are talking to each other. The beginning of their journey as a benefits eligible person, for example, takes place at home when they realize they don't have enough money to pay for food, right? That's it starts way back there. So trying to incorporate all of these things and having them talk together, talk with one another in order to create solutions with their input. And then just briefly, some of the projects we're working on, I'll go into a couple of these more in depth, but for example, we're working on a project to help understand benefits enrollment gaps in Dallas. I just got back from Dallas last week. Improving Latinx outreach in Philadelphia, which I'm going to actually talk about at length, and understanding clients' Medicaid enrollment experience in Michigan, which has yet to take off, but I've learned a lot to take into that. And yeah, so How does this apply to texting and notifications? That's probably on a lot of people's minds. I'm just going to look at the chat really quick at some of in the discovery phase, design researcher.
Yeah, you have a lot of good, no specific questions, but a lot of examples. I would
Awesome.
say, just to sum it up for you, Morgan, because I know you're trying to like do two things at
Yeah.
once.
No, it's
I
great.
would say more in the feedback stage than the research, although
Okay.
definitely a number of people who are interested in doing user research. And so I think, you know, furthering your presentation on user research. And also one thing I want to say is because I've seen the whole PowerPoint. Like we are going to get to more practical applications. I think you're starting this presentation from kind of like best case scenario, but the reality is states aren't going to like hire
100%.
an ethnographer and live in the community.
They might, but yeah, totally.
You know,
and
yeah, go ahead.
Oh no, I was just going to say, and that goes to like having that front and center, like what could that look like, even though it's never going to happen, may influence. Maybe we'll be like, hey, maybe we're not just going to go ask someone to answer some questions without providing an incentive, right? Like maybe we do need to take a more human-centered approach without capacity to do all that other ideal stuff. Totally.
Yeah,
and
we're going to get into that is all I wanted to say. So if anyone was
awesome.
Like, I'm turning this presentation off because this is just some Yale PhD, you know, it's like, right. And I love what you've said of like over the last 6 months, you're struggling with how do we take what we know academically and then actually make that work in the real world?
Yep, exactly. Yeah. So how does this apply to what you guys are doing? So I think that the most important thing that this kind of work does in whichever, you know, community versus user research is it helps make sure that we're asking the right questions. We can't provide the right solution if we haven't identified the problem. And if we're asking the wrong question, we're going to get the wrong data, which is then going to provide the wrong solution. So kind of taking a step back and saying like, what is the problem is really important. It also helps us identify whose voices we're missing. We might find that we've thought a problem is specific to one community, but it may actually exist in another, or that we've been overlooking one community in a larger way. I'll talk about this also when I talk about more concrete examples. And then super salient to what we're talking about, I think, without having been a part of this working group, is that this kind of research helps us narrow in on specifics. So it can help us both, you know, build a succinct and like effective survey that might be delivered via text, or it can help us narrow in, which can then kind of help us narrow in on an expedient solution. Or, and super important to the notifications process, it can also help us with the method, timing, and cadence of notifications. So theoretically, people are more responsive to notifications or asks at either particular times, particular days, at particular frequencies, from particular like entities, and in particular methods. So by doing research with the community and talking to them, we can sort of disentangle and figure out which demographics or subgroups might be more likely to respond to particular methods. So email, text, mail notifications, when they might be more likely to respond to this, how often, or super important in a lot of our cases is from which entity. Is it more trustworthy to receive something from the state, a CBO, state or CBO, some other nonprofit, you know, it depends. So, and then finally, it helps build better feedback structures. So also super salient to where you guys are, since many of you are in the feedback phase. So we can offer a client satisfaction survey after an interaction at any time, but this kind of research taking place before we build the client satisfaction survey can help us identify some of the major pain points in the user's journey. So, you know, to put this in more practical terms, like there's a big difference between saying, please rate how, sending a text that says, please rate how satisfied you were with your most recent call, to please rate how well you felt your questions were answered during your most recent call. Maybe we learned before that client satisfaction survey that a big pain point was that people felt that their questions weren't being answered. So then we make a particular set of solutions and then see if it's actually working, taking that temperature to see if it's working. And also a really important part of that too, I think, and this is something that is part of the balance between like super rigorous research and what's practical is that space, time, and resources are super limited. So I don't think we want to be just like asking questions willy-nilly or in a general manner, because we're going to get data that's not necessarily usable. So we might waste resources doing that. But also I'm learning that like people don't have super high bandwidths, right? Like I personally have filled out like a Qualtrics survey or a SurveyMonkey survey and dropped out, a few questions. And I'm just like, ugh, this is not worth the $2 they're going to send me or something. So we want to make sure they're like short, super relevant, super precise. So concretely, what the first like on the ground project that I did, this starting in January or February, I'm not sure. We've also been building out the sort of research ops operations at the same time, so it's kind of a blur. But one project that we've been working on is part of this multi-year initiative to increase Black and Latinx benefits enrollment rates. So I was called into this project and was asked to seek, quote, feedback from the community on a Spanish translation of our standard English language outreach letters. This translation has been out there in use, but it's had not great engagement rates for a while. So when I was approached with this, I asked, first, whether the community was initially involved in the outreach design process, and how we knew that the translation was the problem at all. So it turned out that the translation was created by a professional translation agency. Doesn't mean it's perfect. Translation agencies and like languages have different dialects, right? So it's not always going to be perfect. But it was, came from a professional translation agency, but also was vetted by our Spanish speaking staff. I speak Spanish at a non-native level and it looked fine. I was like, okay, so like what could be the problem here? So I suggested that instead of going in and just like holding the letter up to people and saying, what do you think of this? Like we back up a few moves, right? And talk to the Spanish speaking and Latinx community, which I'll get into Spanish speaking and Latinx in a minute, to first get an idea of what, they experienced as barriers to enrollment, but also staff at Latinx serving CBOs experienced as barriers to getting people enrolled, but what their perspective was at having kind of a bird's eye view of those particular communities. So, our engagement team put me in touch with some CBOs in Philadelphia. They said, yeah, come in and interview staff and community members. And we ultimately interviewed 17 community members. I think these are the right numbers, 17 community members and 10 staff members. So there is overlap. There were several staff who have benefits experience. So I think it's important not to just say, oh, this is a staff member, they're going to have a different interview protocol, to just like keep in mind people contain multitudes. And these were in both Spanish and English, or from Spanish and English speakers. And after asking a bunch of open-ended questions about, experience, barriers, potentials for improvements, I asked many of the participants what they thought of the letters. So I started out with more broad questions and I was like, hey, what do you think about this letter? And most of them thought it was fine. They were like, it seems fine to me. Like, it's fine. The biggest barriers instead that were identified were stigma, of course. I think that that's something that we can kind of intuitively think about. Stigma and pride and this, expectation that one should be able to provide for themselves and their family, but also fear and worry about public charge issues affecting migration status of either other people in the home or themselves. So there did end up being a couple of translational suggestions, but what we're doing now, instead of focusing on that, is we're redesigning the outreach completely that speaks to some of those barriers. We have to test it still. It's in with our content team. It's very different than what we've offered before. Hopefully it works. It might not work because one of the other barriers, another barrier that kind of goes across all sorts of populations is people don't really check their mail anymore. So we also have to think, and I can talk about this a little bit more, like who checks their mail, who prefers email, where do people prefer to get their information, which is something I try to ask of everybody. And this project, it being the first one, then has started to influence all of these others. And there were so many, hiccups, and there was chaos at some point. We could talk about that when we open this up. But yeah, I mean, a lot of resources do go into this, and that's a challenge, right? Trying to find how to make research like this work with what we have. So super important for this to work was the relationship with CBOs. I don't think I could have gone as me into the Spanish speaking or Latinx community in Philadelphia and been like, hey, I'd like to ask you a few questions about public benefits. No way. So by showing up to a CBO who people already know about, Esperanza was one of the main ones that we went to. We went to a few others. Like, okay, she's with, Esperanza is suggesting we talk to her. We're going to talk to her. Key. CBOs are key. Another one is language. So like I said, I do speak Spanish, non-native level. I am not of a Latinx background, so I don't have that shared identity, but I brought people with me who do have that shared identity. And it helps both with trust building, but it also gives us much richer data. And this was confirmed with some people I talked about in Dallas as well, who had similar experiences. But the quality of responses that we get are going to be different in those situations. Yeah. And like I said, we have to, another challenge is like getting answers that you don't necessarily want, like not necessarily don't want, but answers that might make things difficult. So I asked nearly all of the participants how they preferred to apply and how they prefer to receive information. And most of them said in person, they want to apply face to face, but they also trust information more and are more likely to like move with information more if it's coming from a trusted member of their community. So whether that be a clergy member, someone at a CBO, a family member, a friend, that makes it hard, right? That's not just like, oh, we can just send out a bunch of flyers to people and they'll come to us. Like that's not necessarily what's going to work, but resources, right? Like that is what we can do right now. So we're doing the best we can. Yeah, so the work is not without its challenges. It takes a lot of time. Data is messy because people are messy, I think, and life is messy, right? We don't always learn what we thought we wanted to learn. We have to like think through these things. So before we talk about potential solutions, I want to know from you all, like, what have you encountered when trying to build, these types of research projects or research projects in general? If you're not working towards this right now, what can you imagine at your organization or agency could be a big challenge? I'm going to give you guys a couple minutes to do that too.
Yeah, we keep ending on this 7 or 8 minute mark, which is perfect. So let's just give it a few minutes. I'll just reflect a little bit on what you were saying, Morgan. And I would say in the chat, I think capacity is going to be like a pretty clear challenge. I also think experience is one, right? Like it's I always think of like the metaphor of riding a bike. Like when I was learning to ride a bike, it seemed really hard and I fell a lot of times and I got it wrong. And and now I'm however old I am, and I don't even think twice about like popping on a bike and like going down the street with my boys. So I think and going back to like the emotion of it too, like the emotion of learning how to ride a bike. I am not a person who is fearless. So like thinking about like, yeah, it's scary to do things the first time and knowing you probably are going to get them wrong. So I think experience and capacity rang through in terms of some of the answers.
Mm-hmm.
I think they're framing capacity is a big thing. Compensation is another one. And then experience. I think that rings true for me as well. Like, how do we do this? Where do we start? It takes a lot of time. Yeah. So I'll turn it back over to you.
Sure. Just to answer your question, Belinda, not yet. I'm still in the like writing up portion of this. My hope is to have more publicly visible research to share. And when that's the case, like I will definitely get in touch. You can get in touch, check back at the website, etc. But yeah, definitely on the radar for that to happen. So back to challenges. I use this particular image because it just shows how circuitous and just complicated the road from need to benefits is. And that is also like how complicated and circuitous the ability for us to do research is, right? And it, you know, we can include capacity and all these things on our end, and compensation, and, you know, getting buy-in from our agencies or organizations. But yeah, this is just like, so for each of these people, you know, they could have taken any of these paths to finding information. So like someone in here found information at the hospital, someone found information at church. I don't know what this is, but they found information there. And then, or someone just called a phone line directly. Like, why is that happening? What are the things that took place in each of these? So it's a messy, messy process. And, you know, so how do we account for challenges when it comes to analysis? Like, this is kind of like more analytical challenges, but also how do we account for these challenges from the design side, which I think we can talk about when it comes to compensation, you know, how to do things, you know, do we do things online, over the phone versus in person? Like, there are all of these sorts of more concrete things that to talk about, but then there's also just the messiness. So from my perspective, I think for some of these bigger, like messy analytical questions when it comes, or analytical issues when it comes to the analysis, I think the most important first step is making sure that the method we're using is the right one. So anyone who has a research background or who has taken a research class has probably heard like the research question should drive the method, not the other way around. For those of you who don't have that background, what this means is that certain methods, so be them surveys, focus groups, open-ended, semi-structured interviews, anything that's listed here, are more appropriate for certain questions than others. In this context, so from a more like research-driven context, it has to do with how we make inferences. But in our context of like actually trying to deliver things to people, it usually relates more to what kind of data we're hoping to get and what's ethically like reasonable and responsible for us to ask of our participants. So if we want to understand, for example, more broadly, what people experience as challenges to public benefits access, we're not going to send them, maybe we will, I don't know. I don't think we should send a survey over text message that says, what are some you know, what are barriers to enrollment for you? Like, we should have something a little bit more open-ended in order to then narrow in on something that can then potentially go out as a survey, even if it's only talking to a few people. So that's potentially one way to mitigate some of the capacity issues, saying like, okay, we may not be able to talk to 25 people, but we can talk to 5. And that's at least something. That's a touch point with the community. So that's, oh yeah, or another example is focus groups. This is the thing that we talk about a lot. Focus groups are super, super useful and awesome to get candid opinions and generate ideas from the public. But if we want to understand potentially sensitive conditions in a participant's life, we probably don't want to ask them to have that discussion in a room full of strangers. But, you know, maybe for some groups that does work. Like we're thinking about doing some research with young people, I think 18 to 24, I'm not sure the exact range, but young people, and they're much more open with talking about public benefits and poverty and those things. And I think, I don't know for sure, I think we need to think more harder on it, but I think a focus group would be fine. Whereas it may not work for senior citizens, it may not work for people who have, you know, mixed migration status households, it may not work for other populations. So thinking about these things. I like to always begin with a chunk of open-ended interviews because we have the capacity. We're in, you know, a decent amount of capacity. That's usually like 20 to 25 people, and go from there. Like I said, it's not always going to be possible. It may just be a few people. That's a concrete way to mitigate the challenges. The next 3, this also comes from me being an ethnographer and me being kind of like soft and emotional. I think that remembering the humanness in human-centered research is really important. Listening more than we speak and remaining flexible and curious are all in service of being empathetic towards our participants. A concrete example of that, and this goes to the messiness, right? We're going to get information that we don't think that we need. When I was in Dallas last week, the first person I talked to was a woman who had just lost everything in a house fire. She was super hopped up, stressed out. She was like talking a mile a minute, kind of hard to follow, but like she was still a person in front of me, and I let her talk for a really long time because I could. I wasn't there to like, I didn't want to be there to just grab answers and go. I was actually, and this goes to kind of the experience that you were talking about, Key. I brought someone from our contact center with me who lives in Dallas. He was absolutely fantastic. But this was the first interview he sat on, and he wanted to navigate it like a contact center interview where it's like, okay, well, what's your age? What is the, how many children are in the household? Like trying to just like get this information to get through it. And afterwards we talked about it and he got so much better. So like it's kind of that learning experience, but having that sort of slow letting someone talk about things. um yeah, so she ended up saying stuff that I couldn't really help with. Her daughter suffers from drug addiction, has a deadbeat boyfriend, steals from her. These are things that like I can't do anything about in the moment, that our services probably can't do anything about. But you know, it may, though it might not seem relevant in the moment, it, we hold on to those things and kind of treat all of the data as important because it may crop up later. It turns out that several of the participants I ended up interviewing in Dallas act as unpaid caretakers. These are people who are benefits eligible, either seeking benefits or don't for certain their own reasons. One being I don't need to. It's that's for desperate people. I'm not desperate. That was coming from an unhoused person. That's like a really important thing to note. But a lot of these people act as unpaid caretakers for people in their family due to either physical disability, mental health, or drug addiction. And that might show up somehow in the ways we design our products and services. At this point, I don't know how. But like, I just say this, that I think that when we have like a practical thing that we're trying to do, we might have, I think it's easy to fall into, well, that's not useful. I just like, I need to put that away. It's like everything's useful. Patterns can come up. And then most importantly, this is helps with the community building part, right? That we don't just, we go into a community, a CBO, treat someone very empathetically, builds that trust with the CBO. They, you know, ask us back or we're able to provide things for them. It just kind of, you know, grows from there. So these are super broad brush strokes about this kind of research. Like I said, getting into the specifics about where do we recruit people from, incentives, virtual versus in person, we can talk about it. I'm going to stop there if you have any questions, but I think also just having an open-ended conversation sounds good.